Looks like we are.
You're live.
We're live. Looks like the department may be connecting to audio. Just want to make sure that we have them. All right. Excellent. Sounds like we have audio and video. Wonderful. All right. Good afternoon.
Good afternoon.
Thank you all for being here. This is our first Vaccination Oversight Workgroup, and appreciate the Acting Secretary for being here today and for the weeks ahead. As I've said many times, there is nothing more important in the state of Maryland than our collective efforts to get vaccinations into arms. It is the key link to everything we do. One of these unique periods in time where everything in state government focuses on one objective. And so for that reason, we look forward to the ongoing conversations here. We're joined by Senator Washington and Senator Lamb. There are several briefings for other members who will be joining shortly. Our order of operations and events today, thank you, Senator Rosapep is joining us now. We will hear from Mike Powell, who has been working with the Department of Legislative Services. Will give us a quick overview of the metrics that we hope to be reviewing each week. And then followed by the Acting Secretary has some comments and presentation materials. We're going to try and make it as efficient as possible. We're going to keep it to 45 minutes. So we're going to be very strict on the time and then make sure that there is time for questions and conversation. So with that, without further ado, I hand it over to Mr. Powell.
Thanks, Mr. President and senators on the work group. Jake, we can go to slide 1 if you're ready. I'll get right into the analysis we did. This is all done, I think, from publicly available data that comes from either the Maryland Department of Health or the Centers for Disease Control, the CDC. First couple slides are just a little bit of background. This is the number of new cases daily going back to mid-December. The reason we used mid-December was because that's when vaccinations first started becoming available. And new cases are down about 20% since then. And I saw even in the Sun today, I think, are down a little bit more since we last took a look at this. Jake, the second slide shows the daily positivity rate, which has gone down about 4%. I just want to be clear on that. That's a drop from about 7.5% positivity rate to about 7.2%. I think that's gone down even further in the last 2 days. We can go to the third slide. This is the number of tests that are being done per day. And that's down about 17% since mid-December. So that's it for background. Let's move on to slide 4 if we could. This is the number of vaccinations done daily. It's a combination of first doses and second doses. Second doses are in the orange. And you can see what that trend looks like. And I just want to note that it looks like in the last 7-day period that we took a look at, there's actually a reduction in vaccinations put in people's arms by about 13% when compared to the week before. So a slightly slower week than the one previous to it. On slide 5, it's a little bit confusing, but somewhere close to 700,000 is the number of vaccination doses that the state of Maryland has received. And the red area or orangish area is kind of the number that have gone into people's arms. And so blue represents the number that we have, but have not yet put into anybody's arms. And that number, according to the MDH data, is a little bit north of 300,000, at least as of maybe 2 days ago when we had the most recent data. Let's go on to the next slide. So this is from CDC data and not MDH data, and it shows where we rank as far as the number of vaccinations we've given as a percentage of the population. And we are 40th among 50 states in the District of Columbia. You can see, for example, by way of comparison, like Connecticut has given 8.6 vaccines for every 100 people, and Maryland, I believe, is about 5.1 vaccines for every 100 people. We go on to the next slide. And I just want to explain this. This is the percentage of the vaccination doses that a state has received and has not yet used. So Maryland has not yet used around 59% of the vaccination doses that we've received. And again, by way of comparison, let's pick out Connecticut, which is number 46 on the list. they have not used 38% of the doses that we've received. So Maryland is one of the states that has used the fewest percentage of doses that that have been delivered to us so far. We can go on to slide 8. This shows both of those last variables as kind of a scatter plot. So the higher you are on this is the more vaccinations per population that you've issued. And the further to the right you are, the more of the doses that you are in possession of have been put into people's arms. And you can see Maryland is the red dot sort of at the bottom left. And I'm not a public health person, but I think generally you would want to be high and to the right. The 9th slide, this is something we noticed. This is a number of vaccinations by day of the week. And I think we're averaging around 11,000 or more on most weekdays, but only around 2,000 or 3,000 on weekends. Just something that we saw when we took a look at this and wanted to point out. And then the final slide, number 10. Just wanted to point out, data collection is understandably difficult for everyone during this initial vaccination and during this whole coronavirus pandemic. You will see different numbers from different places. And in the right-hand column, that's what the CDC says has been distributed to Maryland. And the left column is what MDH reports as being given to Maryland. And I just want to point out that it looks like the numbers that we report having received have declined twice over the last 5 days. That may be a correction of data that was found to be incomplete or something like that. I'm not exactly sure the reason. I just want to point this out to show there are different sources of data. Sometimes they don't align exactly. We are doing the best we can with the information that we have available. That is all I had to present. Thank you for your time.
Thank you, Mr. Powell. And now we will move to the acting secretary. And if we could try to conclude by 4:15 so that we have at least 30 minutes for questions, that would be excellent. Over to you, Acting Secretary Schrader.
Great, Mr. President. So in order to move along quickly, there's just a couple of things we wanted to bring to your attention, and then I want to go over the vaccine summary that you receive every day. So if we could put up the planning framework. So we have five variables we're tracking: population priorities, the allocation projections, the operational methodologies, the speed of administration, and then the vaccine uptake. And if we can go to the next, from the very beginning, we've been tracking this framework. You can see over the last 7 weeks, we're looking at the number of doses available. We get about 72,000 a week, rough and ready. You can see we had a little bump up last week for a reconciliation of the long-term care program. The total doses, the 100% eligible population by week, and then what that population estimate would be at 50% uptake or 35% uptake. In the first 3 weeks, as you can see, one of the surprises was that in healthcare and the nursing homes, there was about a 35 to 50% uptake, which was actually quite surprising. We had expected closer to 80 or 90% uptake. As we started moving through, you can see on week of January 11th, prior to 1B, we were tracking with our early priorities of 1A. That made 533,000 citizens eligible for doses of about 417,000. And then you can see the uptake we started seeing. There was a pattern that we were getting only about 50%. So we knew that we had to step it up. And in week 18, we then activated 1B, which made 1.2 million people eligible, and half of that is about 600,000 against the doses that we had as of last week, which is 493,000. I will say we're only focused on, in our reporting, on the first doses. we are tracking second doses, but in order to get somebody a second dose, they have to have a first dose. A lot of the reporting that's combined is a little misleading. Like 702,000 is both first and second doses because there's a lag time of 3 or 4 weeks on the second doses. So as we're looking at the model, we're looking very carefully at first doses. You've probably heard today that, well, as of last week when we went to 1B, as I mentioned, we are at 1.2 million eligible, and as this week with 1C, which brings in 65 and older, plus some essential folks, it takes us up to 2 million. If at a 50% uptake, that's about 1 million people against our projected doses this week. That'll take it first doses to 600,000. Now, what that tells you is that we know that this tells us that the demand will outstrip the supply. Earlier in the first 4 weeks, we were being very conservative to make sure that we didn't have the demand outstrip the supply. But as we've learned over the first 4 or 5 weeks that the uptake definitely is consistent, we feel more comfortable raising the number of eligible folks. And we were looking at 1.2 million originally when we brought 1B on, but then both the incoming and the outgoing administration both said that they wanted to move ahead to 65 plus, was pushed us into 1C, which is fine, but it does put more pressure on the number of eligible folks. So we're anticipating over the next 5 to 7, 8 weeks that we'll be steady at somewhere around 72,000, maybe 80,000, so that it's going to take us a number of weeks to catch up with the eligible population we have now. So I'll stop there on that particular. So what we're doing is very carefully building the infrastructure so that as we get more doses, and we're hoping by the spring and summer, we'll see a very large increase if another couple of vaccines come on the market, if the administration is able to get more production out of the 2 manufacturers we currently have, that'll bring us more doses. We want to have those channels open, which includes pharmacies and other provider channels, because we won't be able to do all of this through the local health departments. It'll be too big a task just for the health departments. And we already have activated the hospitals, which are doing a good job. The last thing I'll say, and I'll stop, is the summary of the daily chart. When we go to that, we have a lot of material here, but we'll skip past a lot of it. The legislature members should be getting this report every day. I will point out that this past weekend, we had the first 2 weekend days with over 10,000 doses, and our allocation is only 10,000 a day. So at the current rate, we're averaging about 13,000 over a 7-day period per day. Within the next 3 to 4 weeks, we probably will run out at the end of every week. We'll get updated with a new vaccine supply, and then we'll have our allocation week over week. If you could go down to the first doses, I want to show. So if you notice here on the left-hand side, the hospitals have really started to pick it up. They're over 71%. The local health departments are at 79%. I want to point out with the long-term care, and again, this is first doses. So we have an allocation of 493,000. Of that, 96,000 are from the CVS Walgreens program, which they are controlling. And of the Part A, that's the nursing homes, there's 55%. So they're finally starting to get some traction. Part B was activated a week ago, Monday, when we activated Part B, but that takes 2 weeks to put the logistics in place. So we'll probably see assisted living and independent living facilities starting to see doses in about a week. However, we had to allocate those doses over a period of time to the federal government, or from the federal government to CVS and Walgreens, and we chose to do it over a 4 or 5 week period so that we didn't have a week where we weren't putting out any doses. So we've been doing a very careful allocation to the long-term care Part B, 35,000 so far. There'll be another probably 40 or 50,000 by the time we're done with Part B. But as you can see, there's a lag there, which does drag the numbers down on first doses.
If we could stay on, if Mr. Secretary, if we could just stay on that slide for a second.
Sure, absolutely. Yeah.
A fundamental question, I think, is, are the second doses that are being distributed, when doses are distributed, are the providers are being told to hold back for the second dose, or is that each provider makes their own decision?
No, we are requiring the providers to hold the second doses. The last thing we want to have is providers, and we've seen some problems that have come up. NIH, for example, used all their first doses and the second doses as first doses, and now they're coming back to us asking us for more doses. We don't want people using the second doses as first doses and then not having the second doses, because at the 3 and 4 week period, Mark, you need those depending on whether it's Pfizer or Moderna.
And are they being distributed first dose? You're getting this many first dose and this many second dose each week, or is it this is your total dosage allocation and you hold back a percentage?
No, we're doing it by first dose and second dose, so we've got visibility on what they're doing, so there's accountability. And what you'll see is the first doses, like 493,000 is what we've been allocated. The delivery is 458. The difference, of course, is the fact that the Part B long-term care hasn't been delivered yet. But against the 458, we've got 330,000 have been administered, or 72%. So if you look at the second doses are going to, what we are doing is we are giving the second doses based on the first dose allocation. But if a provider takes 3 weeks to do all the first doses, like some hospitals have found, we're giving them the second dose, but we're expecting them to hold it so that there'll be a little lag of 2 or 3 weeks, but we got to make sure that that second dose is available for an individual who is expecting it when they get their first dose. So by combining the numbers, it's misleading. We're really tracking first doses as the primary statistic.
So other states where we are being compared, are other states not doing the same thing?
You know, I'll be honest with you. I have not studied the other states. I know we're doing a little bit better than Virginia and Pennsylvania, but I try not to compare other than in broad strokes because it all depends on how you count. We're being very conservative. We only count the data when we absolutely know, based on our application, Immunet, that the shot has been given to the individual on the first dose, or like on the second dose. And we've got a lot of data. I didn't want to bother you with the detailed data, but that's the way we're going at it.
So are you tracking sort of committed doses that have been held, that are committed?
When you say, no, we're not giving credit for committed doses, because our feeling is that when you do that, it sort of muddies the water and makes it look better than it actually is. We're being straight up. These are the actual shots in arms. These are not committed doses.
So one final question, and I think this sort of goes to the fundamental philosophy of it. If you look at this slide, for the long-term care facility Part A, it's a 55% administrative delivery percentage. That's the private providers. The hospitals and the local health departments have, a pretty significantly greater efficiency. My understanding from the most recent announcement is that with Giant and Walmart, it's more private providers and not kind of sort of centralized mass vaccination sites. West Virginia, it's my understanding that they have done significantly better, and the National Guard has been in charge of their distribution program. is that a philosophical choice that the state has made to go with private provider, sort of the pharmacies?
Yeah, well, that's a great question. We believe that when we start getting very large quantities of doses in the spring and summer, and we go to phase 2 and 3, or even the back end of phase 1C, we're going to need a lot more capacity than we currently have. So we're getting the pharmacies on the field now and testing it. We don't want to find out they can't do it or they're too slow later. We want to get them in the game now. We're also looking at community-based sites. We're talking to Kaiser. To give you an example, Kaiser has 490,000 Marylanders in their program, and they have 36% African American in their membership and 12% Latino. So we want them, and we're working with them now to get them. We've already given them doses. They're concentrated in Prince George's County, Montgomery, and up in parts of Central Maryland. So we want Kaiser as a major player in what we're doing, and we're working with them as we speak. That's just one example. The other thing we're doing is, because we're very concerned about the equity issues, we've activated in this early going the federally qualified health centers. So, for example, FQHCs, federally qualified health centers, have 300,000 members. That's 5% of the total population delivering primary care in the state. And we gave them doses early. So, and there's 17 of them. They have about 135 sites around the state. And we're activating that so that starts to move along.
Okay, let me jump to Senator Roosevelt.
Thank you, Mr. President. Thank you, Mr. Secretary, for joining us. It's all very, very helpful. I have one short question you may not know the answer to, and then one other question. You talk about 70,000 doses a week from the federal government. Have I got that right?
I didn't hear it, Senator. 72,000.
How many doses, how often are you getting from the federal government now?
First doses, 72,000 a week with some variability. Like this past week, we got an extra 34. Some weeks we got an extra 4 or 5, but most
I got it.
72,000.
You say 72,000 first doses. Does that mean you're actually getting 140,000 doses total a week?
Well, no, we're getting the 72, and then the 72 second doses are reserved, and then when 3 weeks or 4 weeks later, depending on whether it's Pfizer or Moderna, that's when the allocation on the second dose kicks in.
But I'm saying they're reserved by the federal government or reserved by you?
Reserved by the federal government. They're holding them on our behalf. And they've done a good job of delivering them. We've been getting them. Okay. So far, the federal government has been doing a pretty reliable job of getting us the doses they've told us they're going to. And we have another chart that because we didn't have enough time, we have a 6 to 9 day cycle time for how this process works. I appreciate that.
Yeah. So I just want to clarify this. So you're saying that the federal government right now is giving you 70,000 plus or minus doses a week for first round, and they say to you they are holding 70,000 additional doses for that week that are be held for the second dose for the people who got the ones this week. Is that?
That is correct, sir.
Okay. So here's my question.
Yep.
And this may not be true. I just read it in the newspaper. That nationally about 1 million shots are being given on average a day in the States. If that is true, that would be about 20,000 a day in the United States. 20,000 a day times 7 days a week would be about 140,000 shots a week, which implies that Maryland is getting about half its share. Now, maybe that's a confusion between first doses and second doses, but I would appreciate our staff and I would appreciate your department looking at the question.
We've looked,
unclear.
Yes, Senator, we've looked at that. We think we're getting a reasonable share. We're probably a little less, and we've compared a number of states. I don't have that right here, unless here, give it to me. I'm sorry. I've been trying not to bombard you.
I'm not comparing it to other states, Mr. Secretary.
Yeah.
I'm comparing it to a national number. And I need to answer right now. I'd appreciate your looking at it. I appreciate our staff looking at it because it doesn't add up. Now, maybe it does add up and I can't do the math, but
Right.
I just like to leave it there if we could. 'Cause I want to have respect for other members of the committee.
Yeah, could I just clarify, Senator, I want to make sure I understand the question because we're going to get back, we want to bring it back. You're asking the question, are we getting an equitable share nationally of our 72,000? Is that a fair share that we're getting? Is that the question?
Well, but it is in the context of, I understand 1 million shots are being done a day in the United States. We're 2% of the population. That would say we should be doing 20,000 shots a day. That would add up to 140,000 a week. And you're basically telling us we're only getting 70,000 shots a week. I'm trying to square.
72,000, that's correct.
Yeah,
We will follow up on that.
It's a math question. Thank you very much, Mr. President.
Absolutely.
Senator Young?
Thank you, Mr. President. I have a couple of questions. Decision of how the drugs are distributed within a county. For example, I'm checking with the health department each week and 100% of what they've received. So if we're at 70%, somebody's not getting them in the arms as fast. So is that a decision made by you, or is that one that comes from the Fed? I mean, if we want to get them in the arms, I'd like to see them going to the places where they're putting them in the arms.
Right, and we look at that every week with this cycle. We start on Monday and Tuesday. We look at the prior week's data, and we've adjusted week over week. The hospitals and the local health departments and the providers that are doing well, we make sure that they're getting their share. If a provider isn't doing as well, they may get less, but we're also very sensitive to making sure that there's a pro rata share for every county. So that's why we want to have more than one or two channels in a county, and we need to have the pharmacies, et cetera, among others, providers, so that we've got options in case one group isn't working as well as another. And it varies, I got to tell you, across the state. Some hospitals are doing fantastic. Some local health departments are doing better than the local hospitals. So we're managing the data, and we start, as I said, we start on Tuesday. We look at the detail, and we are also looking to make sure that every county, regardless of the channels, the combined channels have reasonable equity pro rata.
So, Senator Young, if I could just jump in very quickly on this particular point. Anne Arundel County recently posted that this week they were expecting 5,000 doses had scheduled. Were only provided 3,000 doses and then had to shop with the local hospital. Is that, and I don't believe they're the only ones that have been in that situation. How does something like that happen?
Right. So because the demand is now greater than the supply, we're having to allocate across the state. This week, one of the things that happened, which is actually a good news story, we got a late call on Saturday morning, or no, actually it was Friday night, that said we had already done our order for the week, and it was, we had notified everybody. We notify everybody, by the way, with a bulletin. So the local health officers and the hospitals get a bulletin telling them about the decisions that have been made on Thursday for Friday. But Friday night, after everything had been done, we got an order or a notice from the federal government that said, oh, by the way, we did a reconciliation. You're going to get another $34,000 from the long-term care program. We said, great. So we spent all night Friday and Saturday until Saturday night allocating those $34,000, and we looked at who was performing. Anne Arundel Medical Center, or Luminous, had been doing well, and we gave them another $5,900, I think. That's the number off the top of my head. I don't have it in front of me. And we also gave a number of doses to Montgomery County through Suburban. We worked with Johns Hopkins and gave them another set of doses in order to to handle their 75 plus. So anyway, that happened on Friday night, and I think that's what that was all about.
Senator Young, did you have another question?
Yeah, I want to comment on the other one real quickly first. Our health department told me at the end of the Saturday they'd put all their doses in arms, and told me where she thought doses were going the next 2 weeks, and she was going to get less and less. So I would hope you'd take a look at that. If she's getting them all in the arms, I don't want to see her cut, because I want to see them get in the arms. So if you would look
Right.
at
yeah, they're about 73% as of today's report. Everybody, hopefully on the call, has there's a 9-page daily summary report that comes out.
Yeah.
And we've asked that go to every legislator, all 188. Yeah, so in today's report, Frederick is about, and it's the hospital, 73.5%. And then the Frederick Health Department is actually doing very well. It's at 88.3. So we definitely, when they're doing well, we want to make sure they get, but now they're not, if they ask for doses on Tuesday or Wednesday, if they ask for 6,000 and the pro rata share doesn't allow for us to give them 6,000, then they're going to probably be unhappy. And that's just the way it is, the way it's going to have to be. But we're looking carefully at performance, and that's why it's important for us to show you this data. I know it's a 9-page report with a whole lot of very interesting data, and we can talk about that over the next several weeks.
Yeah, I don't want to waste more time on this, but she told me at the end of the day Saturday she'd be at 100%, and I just don't want to see her get cut if she's getting 100% in.
Right.
The governor has pretty much, I don't know if the word's ordered, but suggested very strongly he wants all the schools opened by a certain date. Are we going to be able to accommodate teachers by that date? Because I know a lot of them are hesitant going back into the live classroom full time without getting their shots.
Right. So you're asking a very tricky policy question, and this goes back to the prioritization matrix. If you look at 1B, the teachers are in 1B, and now we also have 1C, which includes everybody that's 65 and over. And if you look at the uptake, the million versus the 2 million, the fact of the matter is that it's going to be a tricky process saying that we're going to vaccinate every person in education. And so this will be a local health department decision. We're hoping working with the local school systems, and it would not be reasonable to say every educator is going to have a shot before schools open, depending on when the schools want to open. And we're still prioritizing adults 75 and older and 65 and over based on the matrix. But what we've done is we've opened up the eligibility. If you could drive that down a little bit, you can see there's 2 million people now as of today who are eligible. We've got 600,000 doses. If we get a 50% uptake, we're shy about 400,000. So it's going to be very competitive.
Yeah, it is difficult. No teacher in my county's gotten it yet because they're still concentrating on 75 and over in the homes. So I just bring the issue up, what'll be there, but it's being really tough on teachers if they're going to be forced back into the classroom without these shots. And I know some kids are carrying them. Unfortunately, my 10-year-old nephew got the virus last week.
So Senator Young, I've got to move on. I want to make sure that we have enough time.
I'm finished.
Senator Lamb.
Yeah, thank you, Mr. President. Thanks, Mr. Secretary. I want to follow up on Senator Rosebeth's point because I am concerned about teachers getting vaccinated. Teachers are in phase 1B, but I'm concerned that by opening it up to include now phase 1C, particularly in the Southwest model that the governor has touted, that it opens up a huge number of people that are competing all together to try to get these very limited vaccines, as you're showing here on the screen. And what that means is that these teachers that are in 1B are being squeezed out. By opening up 1C and adding another 700,000 people into the mix, it's only making it harder for these teachers that are in 1B to get to this process. So can you explain why we move so quickly into 1C when there's already a huge pent-up demand? By opening up 1C only 1 week after we went into 1B, we've basically broken the dam open for a huge amount of demand for the vaccine, but very little supply. And it leaves populations like our teachers that are necessary to open our schools even further up the creek.
Right. Great point. So the bottom line is my preference, and I think everybody's preference would have been to keep to 1B for a little while. The federal government forced our hand last week, both the outgoing administration and the incoming administration.
Can you clarify that, with all due respect? How did they force your hand to move into 1C?
They insisted that 65 and older be put into the mix. And that was a public announcement by both administrations. That really was unfortunate. You're right.
But I thought the states were able to set their own criteria, right? You're able to modify the criteria based on what you see locally in the state.
That is true, but we are also concerned about people 65 and over, and there's been a lot of demand heretofore So even
though this administration announced the move to 1C, you blame the federal government for that move.
I try not to blame anybody. This is a very hard problem, to be honest with you. So, we're all in this together, and tough decisions are going to have to be made.
Okay. And I do want to make sure that we're looking ahead at tomorrow's problems and not trying to just solve yesterday's problems. And so at some point, the supply will increase, hopefully. We're all expecting that to be the case. What is the state doing to prepare for a vastly increased supply? Because what I'm seeing here is that right now, demand obviously, supersedes supply. But once we have a greater supply, all of our capacity is already kind of accounted for and strained, right? Our hospitals are maximizing as much as they can. Our local health departments are moving as quickly as they can, et cetera, et cetera. What is the state actually doing to prepare to solve tomorrow's problems? What type of clinics is the state looking to actually set up themselves? How many clinics has the state set up themselves up to this point that don't include the local health departments? Like, how many state employees have actually administered vaccines for Marylanders across the state up to this point that don't include local health departments?
Right. So you're right on the money. I think, as I opened with in the beginning, our focus right now is building the infrastructure to do just exactly what you said. That's one of the reasons why we're bringing the pharmacies in. I get my flu shot every year. But the
pharmacies have had a very low percentage, as you've seen there in long-term care A and B.
Well, that's a federal program that we can't control. We need to have the pharmacies. I get my flu shot every year very efficiently. I walk into my pharmacy in late August. I get my flu shot and I move on. Our goal is to work with, and we've already got Giant and Walmart. We have others in the mix, and it's not going to just be CVS and Walgreens, and we don't have control over that program right now. So we're going to be looking at those channels. We also are going to be, I mentioned earlier, Kaiser. Kaiser has 490,000 members. That's 8 or 9% of the population in the state, and we've started giving them doses, and we're going to be working with them on community sites as well. And we're going to be working, also opening other community sites around the state that are in the planning stages now, and we can share that with you later. The last thing I'll say, and I think this was a really good move by the new administration, is to bring FEMA into the play, and FEMA is now reaching out to help us, and they're going to provide support around the state, which is a really good move.
Yeah, two quick points, and I'll hand it back over to the Senate President, if I may. So I would like to hear those numbers in future briefings, Mr. Secretary. If you can let us know how many state employees are being trained to actually administer the COVID vaccine once our supply is increased. If you could brief us the next time on that. And I know locally we've had some concern about data being requested by, I think, even MACO and Maryland Association of County Health Officers, that there was a letter from county execs that went to the governor asking for a breakdown of data by race and ethnicity, which is incredibly important. I think they're waiting on that data, and they have not heard anything from MDH or the governor's office for that specific data. If you could follow up and please provide that data and share that data with us, that would be helpful too. And then I know that local health departments like Howard County and others are still waiting on hearing how much they're going to get this week, just this week. Apparently that was supposed to come out over the weekend, but they have not heard yet how much they're going to be allocated this week. And they can't open up their appointments any further because they're concerned about opening up appointments without actually having those allocations assured to them. So if you could let those local health departments know too.
They received those allocations on Saturday at 4 p.m.
Okay, well, I heard as of this morning, some local health departments have still not received that information. And then we've also heard from constituents, and this is my last point. That
Senator Lamb, we got to move on. We got to move on.
Yeah, sure. Okay, go ahead.
Senator Washington.
Thank you, Chairman. Also, thank you. Well, you're chairman of this, but our Senate President, thank you so much. And thank you, Mr. Secretary. Looking forward to, over the next 10 weeks, us really developing a good dialogue and really understanding this process. My questions I have in a few buckets, but I think I want to pull it back a little bit to better understand your management and analysis of the overall program. So, I think you're hearing from my colleagues, there's a number of statements of I can't control, it's the federal program, it's the local program. And I think this is a real opportunity for Maryland to develop our program and what our plan is. So my questions are about you as the head of our program, as the secretary, how we are going through this process. So one, I have a little concern, and I'd like you to explain a little bit about this sort of use it or lose it sort of mentality around the use of the vaccines, where some hospitals may be, and why I ask about is that I'm concerned about making sure when you talk about equity, that the individuals who are most vulnerable to COVID-19 are getting the shots. So, a hospital, for example, may be giving vaccines to its staff that are working from home. Meanwhile, the people who are coming to their emergency rooms are not getting vaccinated. That there's just this general sort of perverse incentive. Can you just talk sort of what evidence that this use it or lose it mentality or approach is really going to get shots into not only as many arms as possible, but into the right arms to curb the spread?
So if I might, Madam Senator, make sure I understand your question. If I hear you correctly, we've put in an accountability process that holds the providers accountable for getting the shots in arms when they receive them. And so that is part of what we're doing. And as we look at the numbers, if we don't see the shots going into arms, we move to other channels and providers. And we are holding the providers accountable. So I don't know if that's the focus of your question.
It is, and why I raise it, again, if, whether it's a Hopkins or University of Maryland or a large health system, you sort of have a privileged class of people who are more educated, perhaps might trust the health system. And so it's going to be easier to get shots into those arms. The truth of the matter is that without sort of trusted individuals administering and providing good information, that those individuals who need it most, and given that it is a dear commodity, that it's going to take perhaps longer to get some of those shots into those arms. And so the rush to just put a lot of shots into arms is going to end up, which I see some of your numbers where you're having some entities that have used 100 over 100% of their allocation. So I'm asking about equity and communication and support that the state is providing to communities where may be a challenge in getting these shots into arms. That it's, in other words, it's not that these providers might not want to, or they're just sitting on it. It is the fact that it is harder to get individuals who are most challenged to take the vaccine.
Right. Well, let me give you an example of a surprise that we had because, and maybe a little different take on what you've said. We agree. We're tracking, by the way, in the 9-page document we send you, you'll see that we're tracking our African American population about 15.3%. So we're worried about that, and 4.1 on the Hispanic. So we have to get those numbers up. Having said that, early on we found that very educated clinicians chose not to get the vaccine. So the people that are deciding to wait is not, I would not characterize that as one group of people. There's a lot of different types of people that have chosen to wait. I think we're starting to see, now that people see that it works over the first 6 or 7 weeks, that we're going to see an acceleration of demand, and we're already starting to see that.
Okay. Well, I guess my answer that I would like, or the question that I would like you to consider in future is, I guess, a more direct question. How is the state communicating directly to make sure that hospital workers, housekeeping, cafeteria workers, warehouse workers are, in these healthcare systems are getting vaccinated versus upper level staff? Looking at those types of metrics. So yes, certainly class, education, there's a full range of questions there. The second is, I'm interested in your follow-ups process for the first shots. If a person doesn't get their second shot, then in a sense that first shot is wasted. Are you tracking that? In the future, will we get, okay, I gave 100, and of this exact, not of the overall first shot, but of those shots, those vaccinations that were received their first week, what proportion of them got their second vaccination? Are you tracking that?
Yes. If we go back to the summary chart, you can see we are tracking. There's a system that we have called Immunet, and that's been around for quite a while. So it's not a new system. It's tried and true. And we have visibility on the providers and what they've received and what they've used. And so you can see in the data we are tracking second doses that the various providers. So, like for example, the Allegheny. Well, I would give a bit different example. Anne Arundel County Health Department has received 2,600. They've been delivered 2,600 second doses, and they've applied about 36 so far. These numbers are small because it takes 3 or 4 weeks before the time is up for an individual to get their dose. And so yes, we're tracking the hospitals and the local health departments on first and second doses. I'll give you another example. St. Agnes. They've received 4,425 second doses. They've administered 1,775, or 40%. So we are tracking this at a granular level to make sure there's accountability.
So, Senator Russia, I hate to do this. We will follow up afterwards because we will be back next week. We have one last question. I want to make sure that we are as tight on time as possible.
Oh, sure. Very, absolutely.
Senator Eckert.
Thank you very much, and I apologize for being late. I was listening to the overall budget. I did have a question. It goes back to what everybody else was talking about. It seems that there was some media communication that those 65 and under were going to be able to get their first COVID shots. All they had to do was go on an appointment and go forward to sign up for that shot. And oh, by the way, if you can't get an appointment in one county, you certainly can go to another county. So my phone has been ringing off the hook with unhappy constituents because they can't get an appointment locally and they don't want people coming from other areas displacing them. When the reality is, in our counties, we have a high percentage of seniors, and there's no way we're going to be able to get out of that tier to get down into that 65 and under. We receive decreasing number of doses in our local counties, and we hold a certain number for our teachers because that's been part of our local plan. It's been handled very well. The announcement also was that you can go to Walmart and get your shot. So what I'm saying is, who coordinates that allocation that, let's say, if our county was slated to get 600 doses and they're short by 100, does Walmart get those 100 doses? And actually, our health departments know better where the people in need are than Walmart. So how is that being coordinated, or is that Walmart addition outside and coming directly from the feds like CVS and Walgreens?
So let me see if I can answer that question. This is the first week that we're testing Walmart and Giant in the state. There's about 34 sites. We've allocated enough to get them started to see so that they can get the process going. We've accounted for the fact that we've analyzed where those numbers are by county so that that's equitably distributed around the state. And as was mentioned earlier, when we need to have that capacity in place, so when we get a lot more doses, and we're all hoping that's going to be the case, we're going to be relying on these commercial channels as well as providers to do shots in arms. And the way the allocation works is they go online to Immunet, they sign up to be a provider, and then we allocate doses to them in our weekly order. And so we will be starting to build that on a weekly basis. We're not going to do it until we have enough doses. They'll only get a small share. We're not going to open it up to the whole Giant network or the whole Walmart network, because that's not, we don't have enough for that.
But are we taking the amount that would have gone to the health department to give them to another entity in the meantime? Because that means that...
Yes, the answer is yes, absolutely.
But that's not fair. With all due respect, that doesn't seem to be fair when there are people waiting in line to get a vaccine with their health department. Why would we open up another entity taking away their allotment?
Well, because for two reasons. One, we have urged the local health departments to start to work with these other entities. And two, for the very reason that was mentioned earlier, we can't wait 3 months to put these capabilities in place and find out that we're not ready when the federal government starts to send us lots and lots more doses.
But we have plenty of people to give it, and they're giving out every bit that they have. And that's all I'm saying, that because you've created a problem where people now are jumping from wherever to come to our county because they've heard Walmart has it, health department has it. If you can't get it in your county, come on down to our county. And I'm just saying, we now have more of a demand than we have supply. It would seem to me that we would go ahead and fill out those people waiting in line to give them their injections before we open it up any further. That's all I'm saying. So let the county health departments have their allotment. And then when they need more resources, then you open up the next one. So you're going to have the good tracking system, with all due respect.
No, I think that's a very excellent point. I would say I want to be mindful of time, but I think probably the biggest takeaway from what I heard today is that there was there's been a strategic decision made at the State Department of Health's level that private providers and a distributed decentralized network is superior to a centralized network with mass vaccination sites run by a centralized program. Is that a fair summary?
We believe we need to do a mix. It's not one or the other. We need to do a mix, because when the very large doses come and the federal government tells us that they're going to send thousands and tens of thousands more doses, we need to be ready for that. So we're doing a hybrid. It's a mix.
Well, look, we are a bit over, and I know that there are a lot more questions out there. And so we will be back next week. And committee members, please look, Mr. Powell will be following up with you individually to make sure that specific questions are followed up with the department. Mr. Secretary, we appreciate your time and look forward to the ongoing conversation so that we can get this right, because it's the most important thing we're doing.
Thank you very much. We appreciate it. We'll be talking again next week. Thank